Chapter 7, Axial Skeleton, Part 1. So the axial skeleton is made up of the bones that run along the midline of the body, includes the skull, the hyoid bone, the vertebral column, and the thorax or thoracic cage. It makes a total of 80 bones. The only ones that we aren't talking about today are the auditory ossicles. These 6 bones are the teeny tiny bones in the ear. So 22 bones in the skull. Bet you didn't think that was the case. Boy, they look weird. So when bones in the skull come together, they form immovable joints. These immovable joints are called sutures. There are 5 sutures whose names you'll need to know. The sagittal suture found between the right and left parietal bones, the coronal suture between the frontal bone and parietal bones. In the back, we have the lambdoid suture between the parietal bones and occipital bone. And on the sides, we have the right and left squamous sutures between the temporal bones and the parietal bones. Again, here is the skull. It's 22 bones. 8 of those bones are called cranial bones because they help form the cranial cavity. The other 14 are facial bones because they help to form the face. We will start with the cranial bones. First up, the frontal bone. The frontal bone, making up the forehead, helps form the cranial cavity, helps form the coronal suture, helps form the roof of the orbits for the eyes, helps form the roof of the nasal cavity, and houses paranasal sinuses, so it has open spaces inside itself. Parietal bones, right and left parietal bones, they help form the cranial cavity, specifically the more top posterior portions of the cranial cavity, and they help form all of those sutures whose names you need to know. Occipital bone. Occipital bone is a posterior inferior bone of the skull, helps to form the back of the cranial cavity, provides a passageway for the spinal cord, helps to form the lambdoid suture, and articulates with the vertebral column. So it is the bone that rests on the first vertebra of the vertebral column. Some special features to the occipital bone. That opening for the spinal cord is called the foramen magnum. On either side of the foramen magnum are the smooth rounded knobs called the occipital condyles. These are the structures that articulate with the vertebral column. All right, moving on to the temporal bone. These 2 temporal bones, right and left, on the lateral sides of the skull. They help to form the cranial cavity. They house the middle and internal ear. They help to form the squamous suture. And they form the only movable joint of the skull by forming a joint that moves with the mandible, so we can use our mandible. Some special features of the temporal bone. This portion sticking out, that is the zygomatic process. This little depression here is the mandibular fossa. Mandibular fossa is where the mandible forms a joint with the temporal bone. So back here, this is the mandibular fossa. Here's the zygomatic process. This opening here is the external acoustic meatus, more commonly known as the ear canal. This large rough area here, that patch, is called the mastoid process. And then this thin little point sticking down is the styloid process. Sphenoid bone. Sphenoid bone is a weird bone. Most of it you cannot see on the surface of the skull, but if you pop the top off the skull and look down, you get a good view of the sphenoid bone. I think it looks kind of like a bat or a butterfly. Sphenoid bone helps to form the cranial cavity, helps to form the nasal cavity and the backs of the orbits, and has its own sphenoidal paranasal sinuses, spaces within the bone. So here again is that view. Pop the top of the skull and look down. We see this hole on either side. That large hole there is foramen ovale. We see a large depression here called the sella turcica. It houses the pituitary gland. And then above the sella turcica, we see these 2 tiny holes here. These are the optic canals. This is where the optic nerves travel from the eyeballs. Ethmoid bone. Ethmoid bone is even harder to see because it's such a deep bone of the skull, not really on the surface anywhere. The ethmoid bone, as you can see, helps to form a portion of the cranial cavity. Helps form the orbits and the nasal cavity. So the orbits, the medial walls of the orbits, nasal cavity, does a lot for the roof of the nasal cavity. Also helps to form the nasal septum, that wall that separates the nasal cavity to right and left. And the ethmoid bone has spaces within it, the ethmoidal paranasal sinuses. So here is a mid-sagittal view of the skull. We can see here the ethmoid bone. It has a top pointy part called the crista galli, and then tissue around the crista galli called the cribriform plate. So again, crista galli, tissue around it, cribriform plate. Lots of holes in the cribriform plate because olfactory nerves travel through that, so we can carry the sense of smell in. Here is looking down into the skull. After removing the top of the skull, we see there's the point, the crista galli, and the tissue around it, the cribriform plate. Nasal bones. Right and left nasal bones help to form the bridge of the nose and the roof of the nasal cavity. We're now doing the facial bones. So we've left the cranial bones, moving into the facial bones. So none of these help to form that cavity. Vomer. Vomer is a thin bone, sort of triangular shaped. It helps to form the inferior portion of the nasal septum. So the ethmoid bone and vomer bone help to form the bony portions of the nasal septum. Inferior nasal concha are these two lower bumps on the inside of the nasal cavity. They rest on the lateral walls of the nasal cavity. They stick out into the air space of the nasal cavity, helping to cause turbulence in the air, so the air swirls as it goes into our body. Lacrimal bones. Lacrimal bones are these little bitty bones on the medial walls of the orbits. The lacrimal bones help to form the orbits and also part of the nasal cavity. They have this little channel that connects the orbits to the nasal cavity so that tear fluid can flow from the eyes down into the nasal cavity. Zygomatic bone or cheekbone. Zygomatic bone, right and left zygomatic bones help to form the orbits and also the prominence of the cheeks. Palatine bone. Palatine bone is an interesting bone. It's shaped kind of like an L. When you look into the inferior view of the skull, this area here is part palatine bone, and then going up here is palatine bone. So again, the L shape. Palatine bone, palatine bone. Palatine bone helps to form the orbits, so helps to form the sockets for the eyes. Helps to form the back or posterior portion of the hard palate, which is the bony part of the roof of the oral cavity. And also helps to form the floor of the nasal cavity because the roof of the oral cavity is the floor of the nasal cavity. Maxilla bones. You see it here in yellow, the maxilla bones, right and left. They help to form the anterior portion of the hard palate, help to form the oral cavity, helps to form the floor of the nasal cavity, helps to form the orbits, as you can see. Holds the upper teeth, so the two maxilla hold the upper teeth, and also have their own maxillary paranasal sinuses. These are spaces within the maxilla bone. So alveolar process is this ridge of bone tissue, that holds the sockets for the teeth. Mandible, the jawbone. It's the only movable bone of the skull. Helps to form the oral cavity, holds our lower teeth, articulates with the temporal bone to give us that movable joint so that the mandible can elevate and depress. On the mandible, we have quite a few structures we need to be familiar with. This smooth knob here is the mandibular condyle. Should be condyle. Mandibular condyle. The mandibular condyle articulates with the mandibular fossa of the temporal bone to give us that movable joint. Then across from it is the coronoid process that sticks up, attached to muscles. So mandibular condyle, coronoid process, mandibular condyle. We also have this chunk of bone tissue that is called the ramus, so the part of the mandible sticking up is the ramus, right and left. The ridge holding the teeth sockets is the alveolar process. So the alveolar process is the ridge that holds the teeth sockets. On the inside of the mandible, on its rami, are a hole on each side called the mandibular foramen, allows nerves to pass through the bone. Here's a view of the skull, a frontal section. We can see the cranial cavity, the orbits, the oral cavity, the nasal cavity, and also the paranasal sinuses, those spaces within frontal bone, the ethmoid bone, the sphenoid bone, and the maxilla bones. They are found inside these bones. They allow the skull to get bigger without it getting heavier, so increased size but not mass. And these spaces act as resonating chambers, so they change the timbre of the adult voice. As it turns out, children do not have paranasal sinuses. Cranial cavity, as we know, is there to house and protect the brain. made by the 8 cranial bones: frontal, right and left parietal, occipital, right and left temporal, sphenoid, and ethmoid. The orbits, right and left orbits, house the eyes. They're made up of 7 bones: the frontal bone, the sphenoid bone, the ethmoid bone, the lacrimal bone, the maxilla bone, and the zygomatic bone. And then that little dot here, that's the palatine bone. Palatine bone is one of the bones that help to form the orbits. Nasal cavity has that wall in the middle of it called the nasal septum, separates it to a right and left sides. Nasal septum is made up of the ethmoid bone, the vomer bone, and the septal cartilage at the anterior end. The nasal cavity, very complicated, has 14 bones helping to form it. We got the ethmoid bone, the sphenoid bone, we have the palatine bone, the maxilla, right and left palatine, right and left maxilla. We've got part of the frontal bone. We have the right and left nasal bones, right and left lacrimal bones, and the right and left inferior nasal concha. And don't forget about the vomer. Oral cavity, made up by 3 bones: the mandible, the maxilla, and the palatine bones, and of course lots of other tissue. And the hard palate is composed of the palatine bone in the posterior region and the maxilla in the anterior region, and that is the same as the floor of the nasal cavity. Cleft palate. Cleft palate is a congenital condition. This is where the maxilla and palatine bones do not fuse together, so there's a space where the hard palate should be. That then makes the oral cavity continuous with the nasal cavity. This is a problem because not only does it make it difficult to talk, but anytime the person eats or drinks something, the food drink will also go up into their nasal cavity, get lodged there, can lead to infections. So it's a pretty serious condition. Fortunately, it can be treated by surgery. So here, this infant has undergone a few surgeries and grown to become this child, and this child has undergone a few more surgeries and grown to become this teenager who is basically normal now after all that surgery. The hyoid bone. The hyoid bone is not part of the skull. The hyoid bone is its own little thing. The hyoid bone does not articulate with other bones. It is instead attached to connective tissue, to ligaments, attaching it to other structures like the larynx, attaching to muscles that attach to the tongue, to the larynx and the throat. But it does not articulate with other bones. And that will be it for this part of the lecture.